Hello, I'm David Ellis, Wake County Manager. As you know, COVID-19 has impacted our community in ways we never expected. One of those ways is how people can worship or practice their religion. During difficult times, many turn to their faith for guidance and encouragement. As the son and grandson of a pastor, I understand that completely. Having your spiritual needs met can be just as important as having your physical needs met during times like these. For some, it's human nature to want to come together with your spiritual family for strength, but COVID-19 has made this hard to do. I want to thank you for your understanding, patience, and flexibility during the county's response efforts. Issuing a stay-at-home order wasn't an easy decision, but it was one we felt was best for the health and safety of our residents. Many of you have found ways to stay engaged with members of your faith community in new and creative ways, while still following the rules set in place to protect us from the virus. Now that the county is following the governor's orders, plans are coming together to slowly reopen. We want to ensure it happens safely. You are a leader in your community, and you play an important role in helping us achieve that goal. Today, Regina Pettaway, our Wake County Human Services Director, and I want to share steps you can take to prepare your congregation for the phased reopening. These steps will also give your members peace of mind that your organization is doing its part to prevent the spread of COVID-19. Places of worship are the backbone of any community. We know you're responsible for so much good in Wake County, and you have opportunities for fellowship and meeting people where they are that just don't exist for us at a county level. So I hope you'll listen with open minds and hearts, and I promise we'll do the same, so all the residents of Wake County can stay safe as we work through this unprecedented time together. Regina?
Thank you, David. I'm Regina Pettaway, Wake County Human Services Director. I'm also your Public Health Director. The past few months have been challenging for all of us in Wake County. Staying at home has not been easy, and it has not been easy for our faith partners who continue to lead their communities, calm anxieties, and also strengthen communities with hope. But we're all in this together, and that's how we'll get through this challenging time, together. Since we identified our first case of COVID-19 on March the 3rd, we've worked hard to bring you reliable information and the latest guidance to keep our communities safe. It's in that same vein that I'm bringing you information today. First, as your Human Services and Public Health Director, I want to thank you for cooperating with the county's stay-at-home order last month and the governor's stay-at-home order that's in effect right now. Both were put in place to slow the spread of the virus, ultimately to save lives. One thing we all know is that COVID-19 is a novel virus. With this virus being new, there's a lot we have to learn about it, and there's still a lot we don't know. What we do know is this: the restrictions put in place are working. By staying home and practicing social distancing, you've helped to protect many others from COVID-19 and to prevent our healthcare system from becoming overwhelmed. And we appreciate you. As leaders in communities of faith, these restrictions have been especially challenging for you. While we work towards protecting the body, we know faith communities like yours play a vital role in maintaining the health of the mind, spirit, and soul as well. And we made that role more challenging for you by asking you to change and limit how you and your members come together to worship. But crises often serve as accelerators for innovation. It's inspiring to see that new and innovative ways you have found to stay connected with your members, and you have continued to practice your faith. Leaders like you are powerful voices that inspire, inform, and educate your congregations, so they focus on facts, not fear. We appreciate the strong example you've set during the pandemic thus far, and hope you continue providing strength and compassion to your communities in the weeks ahead. As our state and county begin reopening, we really need your partnership. We know there will be a new normal moving forward, for which we all have to plan. This includes following the governor's 3-phase approach to easing restrictions in a smart and methodical way. The shift from one phase to the next will be based on data, both at the state level and here in Wake County. If we start to see increases in trends instead of decreases, we may have to step back and reinstate some restrictions. The chances of that happening are far less if we work together and follow the guidance in place. As North Carolina works towards a phase-in-based reopening, now is the time for you to start developing a reopening strategy for your faith community. Governor Cooper's current plan includes starting to reopen places of worship in Phase 2. You can use this time to evaluate which processes should remain consistent and which innovative strategies you've discovered that you'd like to integrate further into your services. You can also look at what changes you need to make for the health and safety of your members. Gradually reopening places of worship is an important milestone, but it won't be the end of our COVID-19 challenges. We here in Wake County are here to help you plan for the transition as much as you can. So let's talk about what you can do to prepare your facilities for people coming back. You can ensure you have enough cleaning and disinfecting supplies to keep your frequently touched areas clean. Sanitizing and disinfecting your facilities are great first steps to prepare for reopening. Try to deep clean your meeting spaces. Consider shampooing carpets and sanitizing seating, bathrooms, doorknobs, light switches, and microphones. You will need to do this after each service. Pay close attention to children's areas. Consider removing anything that's not essential so you'll have fewer surfaces that may be ripe for germs from little hands. We encourage you to post signs about not shaking hands, staying 6 feet apart, and washing hands frequently. Ask your greeters to use appropriate social distancing and place hand sanitizer stations throughout your facility. Also designate a one-way traffic flow for members to limit close encounters. Even when you can reopen your doors, the style and structure of your services may be different. Until things return to some sort of normalcy, you may want to continue offering services virtually, and we encourage that. They're a safe choice for any members of your organization who do not yet feel comfortable returning to in-person services. They also offer members considered at high risk to stay at home a little longer without sacrificing their spiritual needs. Please encourage anyone who does not feel well to stay home. If you choose to hold services in person when the time comes, we recommend that you follow the governor's capacity guidelines. One way to reduce the number of people gathering at one time is to offer multiple services for small groups of people. Before the services start, consider taking the temperature of people entering your facility. And if anyone feels sick, ask them nicely to go home. Also consider a policy requiring members to wear face masks during services to reduce the spread of germs. Another important step to take before services begin is to arrange the seating to maintain social distancing. Removing chairs from their usual setup or blocking off pews or benches are great options. While families can sit together, there should be appropriate spacing on either side of each family unit. If you normally offer paper bulletins, try distributing them electronically instead to cut down on contact. Also, have boxes at the entrances to your meeting space where members can drop in their offerings instead of passing the offering plates. Online giving is another good opportunity if your faith organization offers it. If you practice communion, think about modifying how you distribute it. Consider using prepackaged communion sets. People can pick one up from a table as they enter and use it at the appropriate time during the service. Group meals and coffee stations are strongly discouraged. Your leadership during this process is essential. We strongly recommend you communicate with your congregation about the steps you're taking to maintain clean and safe conditions at your facilities. By making them aware of the changes you put in place, they can have more realistic expectations and better adapt to the adjustments. I want to emphasize that the county is here to help you through this. We can offer guidance, information, and resources to help you worship safely. I encourage you to visit our COVID-19 webpage to stay informed on our response efforts, as well as learn about our latest safety recommendations. The website is covid19.wakegov.com. We also welcome your feedback. You are the leaders in your community. You know your members best and what they need during this time. We are here to listen. We're here to help. You can reach out at 919-856-7044 or email covid19.questions@wakegov.com. I also encourage you to visit the Center for Faith and Opportunity Initiatives, a part of the U.S. Department of Health and Human Services. It's a great resource for guidance and proactive health-related measures you can consider for your organization. Again, thank you all for what you're doing for our residents. I speak for Team Wake when I say we appreciate your leadership during this challenging time. We look forward to the days when we can gather together again. These days are getting closer, and with your help, we can ensure the reopening process happens safely. Thank you.